Great. So we are right at time. So let's get kicked off. I think we've had a few minutes for people to enter rooms. Hello, everyone. My name is Janina Soto, and I am a Global Lead Board member. We also have Doyan here as also part of our board. I will be facilitating this session featuring Delighted to Doula and Health and Help. Thank you to these representatives for joining us for today's event. After I introduce them, they will make a brief presentation. After the presentation, you will have the opportunity to ask the speakers questions until the session ends. There will be another session after this one. Each organization will present during both sessions, so you will have the opportunity to hear multiple presentations today. Here with us today are Priscilla Moore, founder and CEO of Delighted to Doula. And we also have Dr. Victoria Schwark, co-founder, and Alexandra Litkins, HR head of Health and Help to speak. Priscilla, is it Priscilla? Is that how you pronounce it? Why don't we start with you today?
Yes.
Or we'll start with you first, and
Okay.
love to hear from you about your organization.
Okay, I am going to share here. Sorry. This. Oh goodness, you can't see this bar is in the way. Oh my gosh. Slideshow. Okay. Here we go. Hi, I am Priscilla Moore, founder and CEO of Delighted to Doula Birth Services. We are a Dallas-based nonprofit organization, and we have been around since 2019, so we're fairly new, but are making great strides to make change within our community. And so I'm thankful to be here today. So who are we? So we exist to eliminate maternal mortality in communities with the lowest quality of care by offering anti-bias-based, judgment-free education and postpartum support to mothers. And so we do this with our community-based postpartum doula program so that our doulas go into the homes, into the community in person. And we do that to spot symptoms that may be associated with a morbidity or a mortality. And so it is very important for us to pair mothers of color with postpartum doulas of color and that speak the same language. So we are addressing barriers that exist. And then we also want to screen our doulas as they're helping and supporting mothers. We want to screen for postpartum depression, high blood pressure, addressing all stress levels, making sure they have advocacy support, and then of course resources for counseling and resources for other things. It could be food insecurities or housing insecurities. So we are also providing those resources. And so we do up to 4 months of check-in, up to 4 months of in-person service. So it looks different for each family. It all depends on the need. And we go in first and just kind of continue to run assessments, and so that we can get the greatest need, we address those needs. And as soon as mom is on her feet, we exit the in-person service, and then they continue with a virtual support, and up until the year. We want to be with them for a full year. And so at any point in time, if 7 months down the line, mom lose her job or anything that can happen that can cause a stress, we will go back in and support that mother where she is at that time. So it's really important for us to keep track of them for a whole full year, because our goal is to eliminate maternal mortality. And so our vision, we want to be the industry leader and trailblazer for after pregnancy support in Texas. And we want to have a proven track record of creating meaningful outcomes in the community, in communities without maternal mortalities. And so why do we exist? Because, Black women, we are dying at a rate of three to four times than any other race. And so currently in 2022, the maternal mortality rate in the US for Black women is 55.3 per 100,000 live births. But in Texas, the maternal mortality rate for Black women is 170 17.3. And so this is why we're doing this work, because women are dying. They are actually dying. And we want to save our mothers, and we want to help them survive, so that they can raise their, be there for their families. As you can see, Texas actually is the leader in maternity ward closures, and it's also considered the most dangerous place to be pregnant. So yeah, we have to be in the community. We have to support those mothers in the community, give them those resources so that they can, be able to support their families and just kind of get on their feet. So our focus is we want to, find those symptoms that may be associated with the maternal mortality or morbidity. So we're looking at hypertension, diabetes, postpartum depression, and other anxiety disorders. Breastfeeding, we're giving them postpartum education, but it's so important that they get to that first visit. And so we're recording that, and we're making sure that they attend those first postpartum visits. And how do we help? Well, we provide relationship-centered care. That's super important, because we're talking to each individual as an individual. And so we want to see what the need is for that individual. And that's that's building that relationship. And just because one person needs food insecurities, the next mother may be totally fine in that area and may need something else. So we're really focused on that one individual. We provide postpartum doulas. We have an initial contact with mothers right after delivery. We, again, like I said, we go up to 4 months, and then the rest 8-month check-ins, virtual. And then we give them knowledge on self-care building, because who don't need self-care? we need to be able to support our mothers and show them that, how to continue to love on themselves and give themselves a break. We do have a new facility where we're focused solely on wellness and self-care. And so they're able to come in and take yoga classes and do some support, mental support, and nutrition classes and things of that nature. So we're constantly supporting moms in that area. And then again, following up with doctor visits, we're able to go with them and make sure that they get the resources that they need and that they understand what was just said, or so we can help them advocate for themselves. And so with our services, we're providing postpartum services, material goods, lactation services. We have our Motherhood Huddle Cafe, which is a support group, and then also our Motherhood Huddle Club, which is our self-care group. And then we have our in-person and online postpartum classes. Of course, we're physical and emotional support, and we provide several resources throughout the community. And our goals are to reduce maternal mortality and morbidity, reduce postpartum depression, reduce stress, reduce hypertension, improve breastfeeding rates, and increase postpartum appointment rates, and improve the well-being and recovery for all birthing people. And we love to go by Coretta Scott King, that says the greatness of community is most accurately measured by the compassionate actions of its members. And so we love to I use this quote because we want to make sure that we are compassionate to others, and we're showing up for our families in the community. And we want to make sure that we make a safe space and a place for them to come to and know that they're supported. They're supported after birth. So thank you.
Amazing. Excuse me. Thank you so much, Priscilla. Now we'll hear from Dr. Victoria Schork and Alexandra Lickens.
Sure, guys. A second. Yeah. And hi, everybody. Thank you so much for having us today. And that's actually me on the photo, and I propose to start with a small quiz. So you see my face is kind of weird, but the baby's face is even more weird. So please write in the chat, why do you think babies that upset. And we will come a little later to that, like in a couple of seconds. So I'm a physician by training, and I specialized in infectious diseases and tropical medicine and public health for the developing countries. And I actually worked majority of my professional life. I worked in Haiti and in Honduras and Nicaragua and Guatemala. And the thing that I was amazed was that how many kids, like this one, her name is Camila, by the way, this is a girl on the picture. So how many kids like her are dying now in 21st century from the diseases that are very easy and cheap to treat? So me as a young doctor, I was thinking, this is really not correct. This is not right. And I still believe that. And me and a friend of mine, we founded the organization called Health and Help. But let's see what we have in the chat for. Yeah, like, like the baby is sick. The baby is afraid. Yeah, she's frightened. So actually, yeah, she is actually pretty upset because she has a thermometer in her butt. So but you know, like, even though like in the moment she's not very happy, she's a very lucky girl because she's been seeing right now, like by the real doctor, she'll get a real medication. And actually she was lucky enough to be born in the community where we have one of our clinics. So we have our organization over 7 years right now, and we have 2 clinics, one in Nicaragua and one in Guatemala. And we've been helping a lot of communities. We served more than 25,000 people, including babies and women. And basically, it's very important to say why we are there. And this is a lot of maternity deaths, and it's a lot of kids that are starving. It's not enough doctors. But today, because this is like a women empowering conference, and I would like to focus on why it's so important for women in the community. And it's a lot about that we have not just medical programs, even though we like open 24/7 and people always can come and get support. We always have doctors who call and have a life-saving programs like diabetes program, and we provide insulin, and we have like a medication for hypertension and the chronic diseases and the acute diseases, like a lot. But also we educate our communities, because there are a lot of, like, it's easy to say like to provide contraceptive, but some people, like women in the communities, they don't know how to use condoms. Yeah, and the man refused to use condoms, so women were like, yeah, like putting it like as a tea bag, like thinking that like, oh, why I'm pregnant again? But because nobody educate them on contraception before. And we also, like, the last but not least important thing is that women actually can come to the clinics and they can receive all the help that they need for free. And this is important because the culture is a lot to do with machismo and the power of man. And when the woman, before having like go to the clinic, need to come to her husband and ask for money for her kid or for herself to go and get medication, that is actually super important that they have like a community where they can have some help free of charge. So I would let now my colleague Alexandra talk a little more about what are we doing and how are we doing, and about our team. So Alexandra.
Thank you, Victoria. So I'm Alexandra. Nice to meet you all today. I am head of HR at Health and Help, and I will speak a little bit about our team. Because human resources is what we really treasure in our organization. As Victoria said, Health and Help was created about 7 years ago, and it is important to mention that 7 years ago, it was just a dream. But this dream came true because Victoria and her friend Karina, because they believed that they could make a difference in this world. And we all in our team share this dream, and we all believe that people shouldn't die of curable diseases. And because this is unjust and it should be changed, and it could be changed. In Health and Help, we have an opportunity to help thousands of patients live better lives and not to die from curable diseases. And it's also important to mention that our clinics are in some really hard to reach places, but without our team, we wouldn't be able to help our patients. And all the great work our organization does would be impossible without our team. I would like to mention that mostly we work on a volunteer basis, and 90% of our team are women. So I'm going to share with you today a piece of information about the opportunities we have at Health and Help at the moment, because I want to give you the chance to be the part of this dream, to be a part of our team, and to have an opportunity to make a difference. By the way, you do not need to be necessarily a medical expert to become a part of our organization. We for sure welcome doctors, gynecologists, general practitioners, nurses. However, we have many other non-medical volunteering opportunities, both offline in the clinics and also online. We have different levels of roles in our team. For example, now we're looking for the next Health and Help director in Guatemala, who will physically be there for the next couple of years, for the next 2 years, and represent the organization at all levels there. But also we have many opportunities in our online team. For example, our biggest challenge for this year is to expand the fundraising team and develop a strategy for the US audience from scratch. And therefore, we're looking to bring an external expertise and welcome fundraising experts and grant writers to join our team on a volunteer basis, because we want to give this opportunity to those who are interested to help us to meet these challenges. And we prepared a special announcement for you today, and actually no one else knows about this unique opportunity. We have prepared this announcement especially for you, and you will be literally the first people outside the Health and Help organization to know about it. So we would like to expand our board of directors. So if you're interested and feel that this is what you really want to do, please contact me or Victoria and share this information with people you know, spread the word, because if you share our mission and have a clear interest in Central America, so contact us. And if for some reason it is not relevant for you now, but you know someone who would like to join our board and help us provide basic medical care in Central America, please tell them about us. In the next couple of minutes, I'm going to share some information in the chat here in the room. So if you have any further questions, if you want to ask us something, feel free. And thank you very much for the opportunity to be there with you today, to speak to you today. It has been a great pleasure.
Thank you both so much. It's been so wonderful. I'm looking at the clock and I want to be mindful of our next session that is coming up. So if someone has time or has a question, we have time for one question before we segue into the next session. If no one has a question, maybe I'll ask one. So just hearing about both of your organizations, I'm curious, why is it critical to partner with others in the same space? Are there any other organizations that you're hoping to partner with in the future?
I have partnered, I have several community partners, but two of my closest partners, one of them have a easy access clinic. So she services mothers in the community and so for prenatals. And then once mom has delivered, after their 6-week checkup, they come to me. And then I also, one of my other partners that I'm closely with is a recovery center for mothers facing addiction. And so we are there weekly and they come to us as well for self-care, for the self-care and wellness portion.
Thank you, Priscilla. It's really like I really admire the work you do, because I recently gave birth myself, and I know how important it is for the mothers that don't have a very easy access to like public hospital or private services to have someone like close by. And I really love doulas. I think it's the best thing the mother can have as a partner, like maybe after her husband, or even sometimes maybe doula is even better. Sorry for that comment. But as answering your question, Janina, we do partner a lot, because I don't know how clear it was from the presentation. Not it's a basic health centers. It's a place where the people from communities come, and we do have basic health care for them. But for like more advanced help, like major surgeries, or if they have like a major trauma, we actually transport them to the hospitals where they can have specialized care. So, and we do partner, of course, with the public hospitals, but sometimes they, even the public hospitals in Guatemala and Nicaragua, they do like, or don't have all the equipment like prosthetics or like some materials, sadly, because of the economics and lack of the materials and mats and specialists and so on. So we partner with other nonprofit bigger hospitals where we actually collect the list, for instance, of the people that need help, and for specific help with, like, for example, they need like a clap hit operated, or they need like some cataract surgery to be performed. And we do have because we have this good connections, they can still have this for free, and we can help them with transportation and like site, for example, like food and other services there. So I do think that smaller organizations and even the big organizations, they always need someone to have connections with. Otherwise, this all work will be not that helpful, I would say.
Okay, great. Thank you both so much, and to everyone in attendance. At this time, if you'd like to make your way to another session, you'll be able to hear from other organizations. Just a round of applause for both Delighted to Doula and Health and Help for your presentations in our first afternoon session. Thank you both so much.
I think we share this event on our social network, and some people came, like some of our followers came, and they just will stay because we are here. So,
Okay, that's amazing.
No, that's
Thanks for
really
also
lovely.
sharing
Thank you.
it. Yes.
Yeah, thank you guys for coming. Still a quick question from me. Are you doula yourself, or
I am.
Yeah.
Yeah.
You look like one. I would trust you. I would really trust you.
Oh my God, thank you. I am. Yes, I've been a doula since 2010. Yeah. So it's
Oh,
been a
yeah.
minute.
Yeah.
Oh yeah.
Yeah, I worked for the long time in Haiti, and the main role of me was delivering babies, because they didn't have like a doctor at that time, and it was a very rural like actually Catholic hospital where there were nuns, and nuns were very
Wow.
good trained as nurses, and they would deliver baby. But as soon as I came, they're like, okay, we're out, like you are here. Like that's like all the dirty work now will be done, performed by you. So, and they consider like deliveries at night specifically not a very good. Just
Oh
I
my
feel
gosh.
I feel you.
Yes.
All
I love
right.
your
Well, it looks like we have quite a few new people. So how about we hear from the speakers again about Delighted to Doula and Health and Help. For those of you who have just joined us, my name is Janina Soto, and our speakers are Priscilla Moore, founder and CEO of Delighted to Doula, and Dr. Victoria Schwark, co-founder, and Alexandra Litkins, HR head of Health and Help. Priscilla, how about we have you kick us off again?
Okay. Here we go. We got it easier, but uh-oh. I got to the end. Okay. So hello, everyone. I'm Priscilla Moore with Delighted to Doula, and we are a nonprofit based in Dallas, Texas. We service mothers of the community in Dallas. And who are we? So we exist to eliminate maternal mortality in communities with the lowest quality of care by offering anti-bias-based, judgment-free education, postpartum support and education. And so we do this with our community-based postpartum doula program. We have postpartum doulas that go into the community and support moms in person. And they are there to spot symptoms that may be associated with a maternal morbidity or mortality. And so it's super important for us to pair mothers of color with postpartum doulas of color and that speak the same language so that we can address those barriers in the community. And we're also screening for postpartum depression, high blood pressure, addressing all stress levels, also advocating. We want mothers to advocate for themselves, so we're supporting them in advocating, and then also resources for counseling, but also we have more resources even for housing insecurities or food insecurities or anything in that nature. And so we provide up to 4 months of in-person services and then the 8 months of virtual service, because we want to service mothers for a full year and make sure that they're thriving, they're doing well before we leave. And we celebrate them too. I have triplets coming up, and they're coming up soon, and we supported a mom of triplets who was alone. And so those triplets are now about to be 1 year old. So we're gonna throw a huge party for those babies. And so our vision is to be the leader and trailblazer for after pregnancy support in Texas, and to have a proven track record of creating meaningful outcomes in communities without maternal mortalities. And so why do we exist? Because one, over 700 women are dying each year as a result of pregnancy-related complications. And so, in Texas, the maternal mortality rate for Black women is 117.3 per 100,000 live births. That's huge. That's a lot of deaths for Black women. Also, the maternal mortality rate in the US period is for Black women is 55.3 per 100,000 live births. And so just to, if you had a question about that number, if you're looking at the United States, out of the 500,000 plus births that happened, 293 Black women died. And it was said recently by I think it was a council member or something. He said that if we take Black women out of the equation of maternal mortality, there wouldn't be one. So that just shows how deep this is. And so Texas is the national ward leader for maternity ward closures, and is considered the most dangerous place to be pregnant. So this is why we're in Texas doing this work on ground, boots on ground. And so our focus is on hypertension. These are things that can cause a maternal morbidity or mortality. Hypertension, diabetes, postpartum depression and anxiety disorders, breastfeeding, postpartum education. And we want to make sure they're going to that first doctor visit. Also, some of the things I don't have on here would be checking mom's bleeding, right after birth, and making sure that the bleeding is stopping and she's not hemorrhaging or anything like that. And other things we ask are like headaches, if they're having headaches and that sort of thing. So this is just a few things on the list, but we are really assessing moms when we're in the home. We're asking a lot of questions. We're looking at their swelling. We're making sure they're going to the bathroom. It's all of that, those first couple of weeks out of the hospital. And so how do we help? We provide relationship-centered care. That's super important to us because each mother have their own individual needs. So we want to go by the individual, not make them all one picture, not as a whole. It's what this particular mother needs at this time. And then we provide them with postpartum doula. With a postpartum doula, we want to get there immediately after birth. So as soon as they get home from the hospital, we want to make sure we're meeting them there. And again, up to 4 months of in-person and 8 months of virtual. And then we want to build their knowledge on self-care, because that's super important for all women. We need to take care of ourselves, and we focus on self-care. And we currently have a location now that's a wellness center, and we want to make sure that mothers are getting yoga, chiropractic care, massage therapy, nutrition classes, all sorts of things that will help them become better. And then we're educating on nutrition and hypertension, postpartum depression. We're providing resources for them. And again, we're assisting in those follow-up visits to the doctor. And so we have postpartum doula services, material good services, our lactation services. We have a Motherhood Huddle Cafe, which is our support group, and then a Motherhood Huddle Club, which is our self-care group. And we have in-person and online postpartum classes, physical and emotional support, and of course, we provide the resources for everyone. And then our goals are to reduce maternal mortality and morbidity, reduce postpartum depression and stress, hypertension, but we also want to improve breastfeeding rates and postpartum appointment rates and improve the well-being and recovery for all birthing people. It's super important for us to hit these goals and make sure that our mothers are thriving and surviving a full year. Even though we may come out of home from a mom from in-person support, somewhere down the line, if she ever needs support, we can always come back in and support that mom where she is at that time. So as long as it's within that first year, and we are coming up on some repeat moms currently, so it's getting good. And one of the things I leave with is this quote that we live by. Says the greatest of a community is most accurately measured by the compassionate actions of its members. And that is what we strive to do is we want to be compassionate to our mothers in the community. We want to show them that we care. We want to show up. We want to show up when they need us. And that's super important for us here at Delighted to Doula. And so here we are. Thank you.
Thank you so much, Priscilla. I'll now turn it over to Dr. Victoria Schwark and to hear from Health and Help. Thank you.
Hi, everyone, and it's very nice to see all the new people here. So we'll start with a short quiz. Here it's actually me on the photo and the baby. And like my face is not really like happy, but the baby's face is very like he looks pretty upset. So if you just can write in the chat, why do you think this is happening? And we will come to that in a second. So I am trained as a physician, and I specialized in infectious diseases and tropical medicine and public health in developing countries. And surprisingly, I worked in developing countries majority of my professional career. So I worked in Haiti and Guatemala and Nicaragua and Honduras, and I actually was amazed by the amount of people and the kids, like Camila, that's the name of the baby, that's a baby girl, how many of them still dying from the diseases that it's easy and cheap to treat. like something like diarrhea or pneumonia. Yeah, so that is like we don't see in developed countries anymore. So I was thinking, and I still think that it's not really okay. And I don't want to live in a world where kids dying from the diseases that it's easy to prevent and easy and cheap to treat. So me and my friend, we founded the organization Health and Help. And our mission is to treat people in the communities where it's complicated or impossible to get basic medical health. And we built a basic healthcare clinics, and we have 2 of them right now, one in Guatemala, one in Nicaragua. But let's come back to our baby. So as I can see, like the baby is like scared and he doesn't want to be treated, whatever. Yeah, like like this kid has thermometer in his butt, so that's why he's upset. But it's actually a very happy baby. It's a very happy one and a lucky one, because she's seen by the real doctor, yeah, by me, and she will get a real medication, and that she's actually living right next to the real clinic. And just by the fact that she was born there in that specific community where we built the clinic, it just increased her life expectancy dramatically. So our mission is that the kids like Camilla, they are not dying from the diseases that it's easy to be treated. And we work in the places that are very remote, and there is literally no doctors but the people that we have in the clinic, that has like dramatic rates of children with malnutrition and a lot of kids actually dying during deliveries. And today, because we want to focus a little bit on women and how we help specifically women in the communities, it's not just that we provide medical support 24/7, that we always have a doctor on call, that we can take any complicated like delivery and help women to get to the hospital. And if it's emergency, we can help them right at the clinic. So we manage a lot of chronic diseases, and we have programs like diabetes and like high blood pressure for our chronic patients. So we also take care of pregnant women, and we help to get family planning to any woman. And it's not important for us, can she pay for the medication, for the services or not? And it's very important also that we teach the women in the community how to use contraceptives, because a lot of times they have like all these myths that like if they put like intrauterine device, for example, like the baby will like like if she get pregnant, he will have like an antenna on his head or some like crazy things like that. So I think it's very important also that we don't need women to bring her husband if she wants to use any contraceptive, because a lot of health clinics and the facilities, like public health facilities, they actually ask women to bring her husband, and he has to be agreed for her to use the contraception. So we don't ask that, and we are very proud that we can give women the opportunity to take care of their bodies. And we do a lot of other things, but I'm proud that I have my colleague Alexandra today. She's a head of HR, and she will talk a little more about what we do as a team and who are our team, actually.
Thank you, Victoria. So you can also see myself on the picture and other girls. These are the volunteers in our online team. And I'm going to talk today not only about, I don't see my slide anymore. I would like to talk about our team, obviously, because I'm the representative of the Human Resource Department, but also about dreams and opportunities. So as Victoria mentioned, we have 2 clinics now, one in Guatemala and another one in Nicaragua, and Health and Help was just, let's say, a dream 7 years ago. But this dream came true because Victoria was was lucky to meet her friend Karina, and they believed that they could make a difference in this world and change a little bit this world. And now our team at Health and Help share this dream, and we all believe that people shouldn't die of curable diseases because this is unfair and just, and it could be changed and should be changed. So as Victoria also mentioned, we are helping thousands of patients live better their lives and not to die from curable diseases. And also our clinics are in some really hard to reach places. And all this work couldn't be done without our team. And we should never be able to help our patients. And talking about our team, it consists mostly of volunteers, so we work mostly on a volunteer basis. And so we talked today about women empowerment, and 90% of our team are women, by the way. So talking about the opportunities, I would like to give you a chance to be a part of this dream and to make a difference. So I'm going to give you information about the opportunities we have at Health and Help at the moment. Talking about the clinic, so you do not necessarily need to be a doctor or a medical expert to become part of our organization. For sure, we welcome doctors, general practitioners, nurses, gynecologists, and so on. But there are many other non-medical volunteering opportunities, both online in the clinics and also offline in the clinics and online. We have roles of different levels in our team. For example, in Guatemala, we're looking for a director of Health and Help who will be physically 2 years there and live and represent the organization at all levels. But also in the online team, we have our big challenges. For example, this year we want to expand the fundraising team and develop a strategy for the US audience from scratch. And so we're looking for fundraisers and grant writers to join our team on a volunteer basis to help us meet these challenges. And we prepared some special announcement for you today. Literally, you will be the first people outside the Health and Help organization who will know about that. No one else knows about this unique opportunity, not yet. So we have board of directors, and we decided to expand it. So if you're interested and feel that this is really what you want to do, so you have a clear interest in Central America, you share our mission, so please feel free to contact us. Or in case it is irrelevant for some reason for you now, but you know someone who would like to join our board or our online or offline team and want to help us provide basic medical care in Central America, please spread the word, tell them about us. And in a couple of seconds, I'm going to share a link to the board of directors application form in the chat. And if you have any further questions, you can ask us. And thank you very much for this opportunity. It was a great pleasure to speak to you today. Thank you.
Great. Thank you both so much. Great to hear from both organizations. At this time, does anyone have any questions for our organizations?
Everybody's very shy today.
Mm-hmm.
Hi there. Thank you so much. These were such inspiring presentations. And I was wondering if I'm looking at I clicked on the QR code and I'm looking at some of the volunteer opportunities. And I was just wondering if you could maybe share a little bit about what these different, it looks like you have announcer, public relations associate, online copywriter for LinkedIn. So I'm just wondering if you could maybe share a little bit more about some of those opportunities to volunteer.
Yeah, as I mentioned, we have a large online team, large for us, for a small nonprofit organization. We have about 80 people there, and most of them are volunteers. we have an HR department, we have a PR department, and we're building the fundraising department. Also, we have team who takes care of analytics and strategy. And the online team works hard in order to support our both clinics, because we spread the word about us mostly through social media. And so all the vacancies are remote, and most of them are volunteer vacancies. That means that they're unpaid, unfortunately, for now, but we believe that at some point of time in the future, we will be able to fundraise enough to have salaries and to provide salaries for all the team members. And so if you're interested in any PR opportunity, I can tell that if you have like 7-10 hours per week, and you would like to upgrade your portfolio, for example, and you have some external expertise which you can bring to our team. So this is what could be really very interesting for us. And in terms of our benefits, so we also build our network. We have different experts from all over the world. We work in all time zones. We have volunteers from California to Australia. And so if you want to know any details about some specific vacancies and you would like to discuss any of them, you can contact me, and I will provide it via email, or we can have a phone call. So also we're looking for a couple of recruiters now, and I didn't mention it before, but I just want to use this opportunity to tell it. In case you have fluent Spanish, it would be very helpful for us. But in case you do not, it's also possible to join the team.
Thank you. Thank you so much.
Thank you.
I do have one very, very small question. And first of all, thank you very much, everyone, for this. Why was the little girl so wide-eyed in the photo?
Yeah, because she was not very happy of like having her temperature taken.
Okay. I was looking in the chat for potential reasons, and I wasn't sure that I saw a good one, so I figured I'd ask. Thank you. In all seriousness, thank you very much for doing such great work for people who really do need the help.
Thank you so much. That's so
Thank
sweet.
you. I wanted to add to what I was answering to Wendy, that I started myself as a volunteer at Health and Help. So yeah, and I'm already more than 3 years in the team. Victoria, we have a question in the chat. Maybe you could answer it.
Yeah, do local people realize what great and incredible work you doing, and or they take it for granted? So that's a good question, actually. So I think that first, I think that in whatever country or in whatever community you serve, there always will be people that will really be like super thankful, and that will, like, as in case of our patients, they bring us like avocados and like cheese, or like sometimes they bring chicken. Like in the Nicaraguan clinic is like right at the ocean, so people like bring us fish, and they just come and say thank you so much. Like yeah, like so they yeah, the lobsters, like it's like one of the cheapest food they have there apparently. So but it's always people that like are not happy by some reason, that you're not doing enough, or you did it not correctly, or something went wrong and they didn't get, for example, they sit in the line too long, because we have huge lines, obviously, especially in the mornings, like they can wait like some hours till they get like being seen if it's not emergency. So sometimes people get upset. But I do think that, and that's what we tell to the volunteers, that it's the work that we are doing, it's mostly for us to grow as a people. Like for us to grow as a human being, as a specialist, and so on and so on. And if you're going to volunteer or to work with this position, you'll never get very upset on the people, because whatever happens, it's for you and for your personal growth. And because you never know, like people can like steal from you, like, or people can like catcalling you, because like there are some communities that are like, they see the woman and they are like, oh wow, the foreign woman, it's really nice, like should I like invite her for a date or something? And it's very easy to judge everyone by one like sad situation that you face, and we try not to do that. But yeah, mostly people are good, and community protects us, and they build these clinics together with us, and so they feel it like that's their own clinics. So we're feeling grateful for them.
Great. Thank you both so much. Really appreciate hearing from your organizations. Please join us in the networking room for 20 minutes of networking and informal connection. After that, we will all gather together for announcements and closing remarks. So thank you. Thank you all again. Round of applause for our speakers.
Thank you.
Thank you so much.
Hope you enjoyed this breakout.